These antiadrenergic drugs are otherwise termed as sympatholytics or adrenergic receptor antagonists. From the name itself, we can understand that these are the drugs that oppose or act against the action of adrenergic drugs. So let us see its definition. These antiadrenergic drugs are drugs which antagonize or oppose the receptor action of adrenaline and related drugs. They are competitive antagonists at alpha or beta or both alpha and beta adrenergic receptors. These antiadrenergic drugs can be classified as alpha-adrenergic blocking drugs or alpha blockers and beta-adrenergic blocking drugs or beta blockers. First, let us see what is alpha blockers or alpha-adrenergic blockers. These alpha blockers blocks adrenergic action through alpha-adrenergic receptors and it does not affect action through beta receptors. So it's exclusively for alpha-adrenergic receptor and they blocks the action of alpha-adrenergic receptors only and does not affect actions through beta receptor. So let us see alpha blockers. Alpha blockers can be divided into two types, non-equilibrium type and equilibrium type. This non-equilibrium type class is beta-haloalkylamine and the drugs that comes under beta-haloalkylamine class is phenoxybenzamine. And let us move to equilibrium type, which is competitive in nature. They are subdivided into non-selective, alpha-1 selective and alpha-2 selective. Non-selective is again classified as ergot alkaloids, hydrogenated ergot alkaloids, imidazoles and miscellaneous drugs. Let us see the drugs that comes under the class ergot alkaloids. The drugs are ergotamine and ergotoxin. The next one is hydrogenated ergot alkaloids. So in front of this name ergotamine we have dihydro since it is hydrogenated ergot alkaloids. So dihydro ergotamine and dihydro ergotoxin. Next is imidazoline class and the drugs are tolazoline and phentolamine and miscellaneous class include chlorpromazine as the drug. Next one is alpha-1 selective drug and they are prazosin, terazosin, doxazosin and tamsulosin. Alpha-2 there is only one drug and it is yohimbine. Next we will study about general effects of pharmacological actions of alpha blockers. First one is fall in BP or decrease in BP is the effect of alpha blockers. How it happens? They block the alpha-1 receptor. We know that through alpha-1 receptor vasoconstriction takes place. When these alpha blockers block alpha receptor, vasodilation occurs. So this vasodilation causes decrease in blood pressure or we can term it as hypotension. Now let us see the next effect of alpha blockers. So the next pharmacological action of alpha blockers is reflex tachycardia. These alpha blockers cause blockade of presynaptic alpha-2 receptors, which causes increased release of noradrenaline and fall in mean arterial pressure. This leads to reflex tachycardia. So what do you know about reflex tachycardia? Reflex tachycardia means a rapid heartbeat in order to raise decreased blood pressure. So that process is termed as reflex tachycardia. Now let us move on to the next pharmacological action of alpha blockers. So next general effect is nasal stiffness and meiosis. Nasal stiffness is due to blockade of alpha receptors on nasal blood vessels, whereas meiosis is due to blockade of alpha receptors in radial muscles of iris. So next general effect or pharmacological action of alpha blockers is it causes diarrhea. Let us see how it happens. This alpha blockers causes partial inhibition of sympathetic relaxants. So this partial inhibition causes increase in intestinal motility, which leads to diarrhea. So next pharmacological action of alpha blockers, it is they improve urine flow in patients with benign hypertrophy of prostate. Let us see how it happens. This alpha blockers causes blockade of alpha-1 receptors. So this blockade of alpha-1 receptor reduces tone of smooth muscles in bladder trigone, sphincter and prostate. Thus, this help in improved urine flow in patients with benign hypertrophy of prostate. Now let us see some of the uses of alpha blockers. First one, it is used to treat pheochromocytoma. Pheochromocytoma is tumor of adrenal medullary cell. In order to treat that, we use alpha blockers. Next one is to treat hypertension. Third is secondary shock. Fourth is peripheral vascular disease. Next one is congestive heart failure. And final one is benign hypertrophy of prostate. So next antiadrenergic drugs we are going to study is about beta blockers. Beta blockers are also termed as beta-adrenergic blocking drugs. So these are drugs that inhibit adrenergic responses mediated through beta receptors, and all beta blockers are competitive antagonists. Beta blockers can be divided into or can be classified as non-selective and cardioselective. Non-selective ones are those that block beta 1 and beta 2 receptor, whereas cardioselectives are ones that block only beta 1 receptors. Non-selective can again be divided into three, that is without intrinsic sympathomimetic activity, and the drugs are propranolol, sotalol and timolol. Next is with intrinsic sympathomimetic activity, pindolol. And third one is they have additional alpha blocking property besides non-selective beta 1 and beta 2 blocking activity, and the drugs are labetalol and carvedilol. And the drugs coming under the class cardioselectives are metoprolol, atenolol, nebivolol, betaxolol, esmolol. Now let us study another system of classification of beta blockers into three generations. So first generation, it is older and non-selective, and the drugs under that class are propranolol, timolol, sotalol and pindolol. These four are the ones that comes under the class first generation. Now let us see second generation. So second generation drugs are beta 1 selective, and the drugs included are metoprolol, atenolol, acebutolol, bisoprolol and esmolol. And for third generation, they are the ones that have additional alpha blocking and or vasodilator property, and the drugs that comes under that class are labetalol, carvedilol and the nebivolol. Next, let us study about the pharmacological action of beta blockers, and for that we are taking the drug propranolol as prototype. First, let us see pharmacological action on heart. In heart, propranolol decreases heart rate, force of contraction and cardiac output. Next is its action on blood vessels. In blood vessels, propranolol decreases blood pressure by the blockade of beta 1 receptors. Third one is pharmacological action in respiratory tract. Propranolol causes bronchoconstriction due to the blockade of beta 2 receptors. Next, in CNS, this drug propranolol has no overt central effects. Next pharmacological action is as local anesthetic, but they are not clinically used as they are irritant in nature. Next one is pharmacological action on eye. Propranolol, another beta blocker, reduces aqueous humor, so intraocular tension is lowered. Next is pharmacological action on uterus. They causes relaxation of uterus. Now let us study where we use beta blockers. We use beta blockers in the treatment of hypertension, to treat angina pectoris, in the treatment of cardiac arrhythmias, myocardial infarction, congestive heart failure, pheochromocytoma, to treat thyroid toxicosis, in the treatment of migraine, anxiety and glaucoma. Beta blockers will be employed. So next drug is alpha and beta blocking drugs. They are labetalol and carvedilol. Labetalol is a competitive blocker at beta 1, beta 2 and alpha 1 receptors, and this oral labetalol is used in the treatment of essential hypertension, and labetalol will be given in IV form for hypertensive emergencies. Major side effect is postural hypotension. Next is carvedilol. Carvedilol also have beta 1, beta 2 and alpha 1 adrenoreceptor blocking property. It has antioxidant as well as antimyotic property, and it is used as a cardioprotective in congestive heart failure. And it has a T-half of 6 to 8 hours. Thank you for watching. Please do like, share and subscribe, and let me know about the comments in the comment section. Thank you.